Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 71 of the Ask Dr. Angela podcast. So I know I say this all the time, but I'm just going to say it again. I love all of the feedback, all of the questions, all of the topics that you guys are flooding me with. I'm just going to jump right into today's topic. Wounds in the scrotum. Now, the reason that this is funny is because, what did I just say to you? I'm everyone's favorite OBGYN. I specialize in vagina, not scrotum, but I certainly appreciated the gentleman that reached out to me via Facebook and posed this question to me. And the question went something like this. Hi, Dr. Angela. My 12-year-old brother has wounds on his scrotum, and the wounds have this yellowish substance in them. He finds it hard to walk. How can I help instead of visiting the hospital? So we all know what the obvious answer is here. I mean, I don't have to be a doctor that takes care of scrotum to know the answer to that. This is infected, people. Infected. So even though you want to avoid going to the hospital, if you don't have a physician, you need to go to the hospital. That's the best thing that you can do. The obvious signs of infection, regardless of what your specialty is, it's the same across the board. Redness, swelling, pain, and coming from a surgeon, any kind of abnormal discharge, yellow, green, foul-smelling, pus, those are not, and I'm going to say that again, those are not good things. So my recommendation to this young man that happens to be sending this from India, I was like, what? India? Anyway, India represent, was you need to go to the hospital. And this is coming from a woman that specializes in vagina and not scrotum. And so, of course, he received that advice warmly, and hopefully he did take his little brother to the hospital to have that addressed. That sounds like it's going to require either an IND, which means incision and drainage. Yikes, fellas. Maybe some warm compresses, minimally, to help draw that infection out. And again, I'm just saying, I haven't exactly done an exam here. But more importantly, likely a course of antibiotics, because you don't want that to get worse. So, thank you so much for submitting that question. I appreciated it more than he knows. It just shows that our reach is far beyond the borders of this great U.S. of A. So again, people, if you have a question, topic, anything that you would like addressed on the Ask Dr. Angela podcast, you can go to www.askdrangela.com. Click on the microphone on the right-hand side of the page and do what you do. If we do happen to use your question, someone from my team will reach out to you and send you one of our bomb-ass t-shirts. I'm going to have to post a picture of myself wearing one of these bomb-ass t-shirts. That I don't think that I have done. That, and you can see my wild and crazy curls because my hair is getting long. It's getting a little bit out of control. But anyway, let me leave you with this. Letting go isn't the end of the world. It's the beginning of a new life. All right, people, let's get ready to embark on your new life. Until next time, look better, feel better, be better. I can't wait to reconnect with you on episode 72 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.